Hi everyone, it's Dr. Andrew Orr here, and I am here as part of Endometriosis Awareness Month, and I'm here today with the beautiful Angie Kent. And today we're going to talk about Angie Kent just as Angie Kent and nothing else.
Yes. Angie Kent with all her invisible illnesses.
Invisible illnesses that have now been diagnosed.
Yes, exactly.
Actually, speaking about that, let's go back to that, because I heard you say something about being gaslit, and it's something that I talk to women about. I often say a lot, and I get into trouble for it, but I always say that women are often missed and dismissed so many times. Have you felt missed and dismissed or gaslit?
I definitely have felt that. I think growing up, especially maybe not so much now, but back when in the 90s and early 2000s, when all the girls my age started to get their period, we were kind of told, because our mothers and their grandmothers were always told that period pain is normal, because back then they wouldn't have had anybody telling them that their symptoms were out of control and not normal. So my mum was kind of like, yeah, periods suck. Like, we didn't really have a big talk. It was just like, they suck. And teachers don't really tell you about it. They're just like, oh, you bleed. So for so long, and I saw a lot of male doctors, they were kind of just like, you'll be right, or go on the pill. Or so for ages, yeah, I feel like because it was just something we had to deal with, that I felt like I was just constantly dismissed and told that I was hormonal and had anxiety, and not that I actually had, well, now I know I had so much going on. Of course I had anxiety. I was in so much pain.
Yeah, I often find that a lot of women with gynecological issues will have anxiety anyway, but I think a lot of that anxiety is born by, like we just said, being missed and dismissed, but not knowing what's going on with your body and thinking, do I have to put up with this for the rest of my life? This is how it's going to be?
Yeah, it's exhausting. And you think, you're always kind of told back then, which I know is changing a lot now, to hide your period from other people, especially men. And I think that causes a lot of anxiety too. So if you're not like every other girl who has their period, that doesn't talk about it and maybe doesn't have pain, you've also then got that added pressure of like having your period, not talking about it, and being in pain and not talking about it, which is like all the things.
Yeah,
And
it is.
It gets exhausting, and you do get anxious because you feel crazy. You're like, why am I suffering so much and everybody else seems to be okay, or not talking about it?
Yeah, and I think this is the biggest problem, is it starts off very young about not talking about it. It's telling people that things are normal when they're not. And we always say period pain is not normal. It's common, but it's not normal. But men need to know about this too, so that they can be understanding to partners, daughters, wives, girlfriends, the whole lot. It's very important that everyone knows about this.
Oh, I think so. I think everybody should learn. If you're becoming a parent, you need to know all the things, not just the things that are familiar to you. If I could go back time, or in time, if my parents could know that would be a game changer. But yeah, again, my dad would have no idea. Even now, he wouldn't want to talk about it. So I think a big thing for men, like especially cisgender men, and actually not just cisgender, all men, that they hold more space for women and those people with wounds, because that's your first home after all. And a lot of people like to stick their bits in it, yet they don't want to learn anything about it.
It's so true. So, very true.
Why don't you get to know what you love putting your bits in?
Actually, it's funny, when I learned about a lot of disease states, and that a lot of those disease states are put there by men in the first place. So, or like pelvic inflammatory disease, we always say that it's penis injected disease. And because a lot of it is like HPV, there's other things that go around. So men are part of this.
Yeah. Well, I think there's got to be so much more education surrounding it. And once there is, I think that will be the game changer.
Yeah, I think so too. But now we have to encompass, like transgender, because we've got women crossing up to become men becoming women, and so forth, that are identifying with certain things as well. And they need to know that both men and women can have certain things like interstitial cystitis, for instance, which we'll talk about in a bit. But there's a lot more things that we need to know about.
Exactly. That's why I always like to say, and I try to pull myself up, I don't just say women anymore, because people with wombs suffer from endometriosis, not just women, you know?
Yeah,
Non-binary, transgender. So people, I think it's really important for people to start saying people with wombs are being were being medically gaslit, still are, and everybody should have a clearer understanding of how it all works.
In the early days when I used to put a lot of information out, I used to be a bit shocked because a lot of women would even, while we do have men that can be quite harsh towards women and not know what's going on for them, often we'd see sometimes women being quite harsh, no womb, no comment. And I used to think about this a little bit and think, but what about these women that don't have a womb anymore? What happens to these ones that don't have it? They've had a hysterectomy. We can't say no womb, no comment. So it's being accepting of everyone, isn't it?
Yeah, definitely. That's a big one.
Yeah. What's been the hardest thing for you reckon? Like,
in terms of
just in general, from start to go, like what's been the hardest thing for you from like diagnosis? Well, tell us about you. Tell us about what you obviously have endometriosis.
Yes.
And what?
I have endometriosis. I found out I had endometriosis when I was 26, I think it was. I'm 32 now. So it was quite later on in life. I feel like I had it probably as soon as I got my period, but obviously didn't know. And then from there, I found out 2 laparoscopies later, right before my 3rd laparoscopy, I found out that I also had polycystic ovaries, a fibroids, and now I have just been told I have interstitial cystitis, and I always say this one wrong, the evil cousin of endometriosis.
Adenomyosis.
I always say it wrong. I always say endometriosis, but I've got that one too. I've only just found that one out, so I don't know much about that one yet.
Yeah. So when it's quite easy when we say adenomyosis is basically confined into the uterine tissue in here, and endometriosis is usually outside the uterus. But if we put adenomyosis and endometriosis under a microscope, they're exactly the same disease. They're just in different locations.
Oh, so that's, because then it's the outside layer and then the inside is where, and they say it's the evil cousin because is it more damaging when it's in?
It can be, yeah, because it's encapsulated basically in the uterus. So it's just spread into the uterus itself. And that's why it can grow bigger and become bulky. And that causes women lots of bleeding issues too, most of the time, because it's confined in deep within the uterine tissue. And it's harder to diagnose because you could go in there with a hysteroscope or a laparoscope and not see it, but an MRI might. But yeah, really, it's endometriosis. It's just in a different location.
So does that mean that the symptoms are quite similar?
Very similar, very similar. So like if we say, for instance, say we looked up, say this is the Royal College of Obstetricians and Gynecologists. So when we look up endometriosis, when you look at their guidelines here, through here, they always say you should always rule out things like adenomyosis, interstitial cystitis, pelvic floor spasm, which we say is like hypertonic pelvic floor, and look at everything else. And treatment should be individualized, and it's important to involve a woman in all the decisions and diagnostics, and it might need a multimodality approach. But how many women get that?
You know what? Not many women I know. I think a lot of them, just like I was saying before, they just think it's normal to feel that way.
That's right. And they often will, like you, get the diagnosis of endometriosis first, and then nothing else is looked at, where really everything should be looked at. Okay, if we look at interstitial cystitis, pelvic floor hypertonus, adenomyosis, endometriosis, they've all got the same symptoms. So this is the whole thing, is women go for years thinking, oh, it's all endometriosis, but they could have adenomyosis. They could have the trifecta like you have. So it's important to diagnose all that.
Yeah, and it can take, in many cases, they say it can take so long.
Yeah, I think Endometriosis Australia was saying the average time to diagnose is 7 years, but the fact is that some women are not diagnosed ever, and it's probably more like 10 to 20 years with someone like you. You probably had it from 13, 14, 15, whenever you got your period.
Yeah.
No one listens to you, and then you get diagnosed in your early 20s.
Yeah, that is a very long time. I feel like I've heard a lot of women who reach out have not been diagnosed until they were like, at least, yeah, probably earliest in their 20s. Maybe different now. I think a lot more parents are more educated because there's so much more out there. So they take their children with wombs to the doctor and get diagnosed quicker, which is great.
Yeah, they do. And it's also telling parents that don't do the wait and see approach, because,
No.
you could wake up, your poor daughter could go through years and years of pain like you probably did. And then, you don't want your organs stuck together, because endometriosis can start sticking organs. It can cause adhesions. It can cause multiple pain pathologies. It's a horrible disease.
Yeah. Yeah, definitely.
I think the best way to explain it to women sometimes is more like the C word, cancer, because it spreads like cancer, but it's a benign form of cancer. But the way it behaves is very much like cancer, because if you leave it, it just grows. Or I always say, like a weed in your garden, you leave the weed out there over the weekend, and next thing you've got 10 weeds popping up.
That's so true. And is it true that when you could have it when you're younger, but the symptoms would obviously get worse as you got older if you weren't doing the
I
right
can,
thing?
yeah. Most of the time, yeah. And we're finding it in women as young as 5 years old now, accidentally. Like some poor young kids got pain, and we think, oh, it's the appendix. So they go and have a look for the appendix, and then they've got a belly full of endometriosis.
Kids as young as 5.
Kids as young as 5.
Oh my God, I had no idea.
Yeah.
I thought it was more something when you got your period.
Yeah, and that's when it starts to exacerbate, because you get your period and it exacerbates.
Oh my God, I had no idea about that.
But a significant portion of women with endometriosis are asymptomatic. They don't have any symptoms at all. So they could go through their whole life not knowing they have it. And the only reason we find them is if they decide, oh, I want to have a baby, and then they're having trouble. We go, okay, let's do a laparoscope, go on and have a look. And 50% of women that have a laparoscope will have endometriosis.
It's so wild to me that so many women have it, yet it's still not something that people really know about.
It's true. I think there's like you probably know, like there's the education is there, but it's all about education, and it's very targeted probably to within the community and not outside the community. And we're probably targeting the wrong people. So we should be targeting schools, general practitioners, because hey, if women are being missed for 10 years or more, who's missing them? So we got to get them. And then educate girls from a really young age that period pain is not normal. So when you get your period, that's not normal.
Yeah, that would be so ideal if they started doing that at schools. And that way they wouldn't have to suffer for so long, and then it wouldn't turn into this almost, I feel a lot of people don't just have endometriosis. It's kind of like this spiraling thing where it's like, then you've got this. I mean, I had no idea for so long that I had all the other things, and I was just like, oh, I just not that you just have endo, because endo alone can be so obviously damaging, but you find a lot of people have a lot more than just endometriosis.
Probably more than 80% of women with endometriosis have other pathologies, and that's just not diagnosed. So everything gets blamed on endo, and endo will cause all those things. But generally speaking, when women are getting abdominal pain and ovulation pain and rectal pain, and, like some woman said to me today, it felt like I was having a knife stabbing into my uterus.
Yeah.
That's the pelvic floor firing off. So that's all inflamed, and there's treatments for that. And then it could be, your bladder could be inflamed and you've got interstitial cystitis. And
it's all linked in some way, or just from the stress too. I don't know if, obviously I'm not the professional, but I just feel like that makes it so much worse as well.
Actually, you brought up a good point, because one of the things that a lot of women will do is seek help to get pain medication and surgery, but a lot of them don't get help for the mental aspect and the stress and anxiety that goes with endometriosis. And what they don't realize is the more stress you have and the more anxiety, it ramps up those pain pathways. So a good psychologist that can deal with pain is part of pain management, because you can reduce pain by about 60% with a good psychologist that works with pain.
Oh, that's so good to know. I feel like so many people would not even think of.
No.
You just think, get it under control, get rid of the pain. But what's that saying where it's kind of like, if your body is suffering, then your mental health tends to suffer too. If your mental health is suffering, then your body, it's like hand in hand.
It's a vicious cycle.
Yeah.
And I think the one thing, when we start talking about the mental aspect, I think when you talk about, I've heard women say, oh, well, it's not as easy as just doing therapy and my endometriosis goes away. And it's not, but it is part of it. And the more we can help those women on that, like that mental aspect, like you said, I felt crazy, and they need that support as well. And it's a big part of their treatment.
Yeah. Oh, definitely. And it can affect so many relationships as well, because there isn't such a space being held for endometriosis and all these invisible illnesses that people don't understand. So therefore, they don't understand if you can't be intimate with your partner because you're sore, or you physically can't, or you're like emotionally drained. It's not just I think a lot of people think, oh, endometriosis is just when you get your period and you're in pain. It's like, it's never ending. It's like chronic fatigue. It's your bowel, having to go to the toilet all the time. It's the moods. It's everything. Like sometimes right before my third surgery, I was like, some days I just couldn't not get out of bed. I was in so much pain. I felt like such a monster all the time. So I was like, I didn't want to be around anybody. And people don't realize that. They kind of like snap out of it. It's like you physically can't, because your levels are just like, or you're giving every single last bit of yourself to be awake, that you can't do anything else.
Yeah. And that's horrible when you can't function like that. And that's not normal. No. It's not a way to live a life. And so how important was diagnosis to you?
Oh, it was so important. I think when I got diagnosed, I didn't realize really what endometriosis was. Again, it wasn't really something I knew anybody had or anybody spoke about. And I got diagnosed, and my doctor who I was seeing, my GP, who I was seeing since I was 21, so she knew of me quite well. She knew me generally, that I had anxiety, that I suffered with like my eating disorder. I had, all that kind of stuff and all the other bits and pieces that went on. But she didn't obviously know much about endometriosis, obviously just generally. And then she passed me on to a surgeon. I had the ultrasound and they couldn't find anything, which is quite common.
Yeah.
Yes. So it doesn't mean you don't have it just because they're like, we can't see it. I've always been told.
No.
When I went to, when I had my surgery, I think I met my surgeon. It was all through public, and I'm not saying anything bad about public at all.
Yeah, we'll talk about that. Yeah.
My first experience was just, I wish I knew how. I thought it was just going to be kind of like a little surgery that I could bounce back from quite quickly. And I knew it was going to be quite painful, but I didn't realize how, not traumatic, but how much it would take to recover. And I didn't know my surgeon. He didn't know about me. It ended up being quite awful. And I had a lot of damage from that first surgery because I didn't know anything about endo or the procedure. So I kind of just let this stranger go into my body and burn off things. I'm pretty sure back then he was burning things off, not the other way. I always forget the technical terms.
Yeah, excision. Yeah. Yeah.
That's and I just feel like, yeah, I learned so much more as I got older and through my naturopath about the best way to go about it. Not just, okay, you may have it, go get surgery and see. It's like it's a whole process. And I just hope there's not other people going through that. And I feel like there's a lot of people that would though.
Yeah, there is. And you brought up some really, really, really good points. One, it is important to see an advanced trained surgeon, which have, done years more surgery, and they know endometriosis back to front, and their surgery skills are amazing. Unfortunately, with the public system is that you often get a trainee.
Yeah.
And they've got to train, right? But yeah, you're often their guinea pigs, and they often don't know what they're looking for. They miss things, they stuff things up. So that's a big part. And then that could leave a woman scarred for life. But then some women, that's all they have. They only have the public system because of their demographics, their social status or monetary status. And but yeah, often it could be scarring them for life.
Well, that's the thing. I feel once you have something like that, the first time you are quite frightened from there on to go back and do it again properly, because you're like, well, what makes me trust that this time? And then this is our body. This is our what could potentially hold. Some people want to hold children.
Yeah,
but
correct.
I just feel like once you go through that, once you are then quite frightened to do it again. But like you said, you got to make sure you have a great surgeon that knows your history and past probably a little bit more than just anybody just getting in there and scraping it out, because it wasn't a good time, that's for sure.
No, and it's like having an apprentice, do work on you when really you want the master working on you. That's what happens. And
yeah. Oh God, definitely. That would happen so often. I briefly remember, I think I've trauma blocked it, but I briefly remember them making me sign things, being like, would you be okay? We've got so-and-so. And I was just like, sure, because I'm such a people pleaser too. And I had nobody to say, well, this shouldn't happen. And I didn't have any money. Like I was only 25, 26. A lot of people in Sydney, especially if you're going there and you're working heaps of jobs or anywhere that's expensive, you just want answers, right?
yeah.
And so you go through public and you feel that people you should trust people with your body, but I ended up in emergency and they thought I had an infection, and I was just so traumatized, and it was just gross. Like the scarring was so bad, but I'm glad I bounced back, and I ended up having, amazing surgeons and professionals now. But I want to share that so people can learn through me so they don't have to go through that.
Yeah, and it's important that people, I think you brought up a good point about checking who's going to be working on you, because you do want that expert. You want someone that knows endometriosis back to front, inside out. And that's not just on the medical side, but if you go into allied health or complementary medicines, you want to make sure that they know what they're doing too, because it can be both sides, right?
Yeah. Oh, definitely.
Yeah. So, and like we say, with the GP even, it's not their fault, because the last time they did gynecology would have been back in college like 20 years ago. But it's the same in natural. A lot of them don't do postgraduate training either. So they often, the last time they did learn about gynecology was back in college for one subject as well. So this is why this is so important to see the right people. And it sounds like you are seeing the right people now.
I am. Well, look, I found you. Good. It's a while, but I'm finally there. Better late than never, right?
That's it. It is better late than never. But there's always answers out. Like there's always answers out there. You just have to go and find it, and you have to find the right people. Some of it's luck too.
Yes, definitely. And I do find that there is so much more out there and people have more access to information on social media. But as you and I were talking about, you can't always take on everybody's things. You've got to make sure you still see the professionals and don't take everybody's body is different, and no two bodies experience anything the same. We were speaking about that. So it's very important.
Yeah, I think that's really important you brought that up, because while we have endometriosis or adenomyosis or interstitial, the disease itself, every woman will experience something different, especially like endo, for instance. Some will only just have endo belly and that's all they've got, which I'm sure you've experienced on many times.
Yes. Yeah. I have.
And, you know, some women look like, you know, they're 9 months pregnant, and, you know, that's part of it too. But it's important to, see those right people and be careful where you get in, because like you said, you know, everyone is an individual and all your symptoms are different to each other. You've got the same disease, but you could all present differently.
Yeah. Oh, definitely. You notice that once you start joining these or connecting with these people, everybody's so different. Some are more extreme than others, but just because that's the case doesn't mean that you still shouldn't go and get checked out.
That's right, seeing a professional. Because as much as we might like, it's great to have information like Dr. Google. But some of the groups too they're a great source of support, but sometimes they can become a little bit toxic too. Like they can give bad advice even, well-meaning to give advice, but some of the advice can be bad advice based on personal opinion. So this is where it's important to see those experts and professionals.
It does. I definitely agree, but it does make it hard. Do you have any like suggestions for people who can't, let's say, like afford to go see a specialist all the time or afford all the allied appointments that you have to do? Where would you start if you only have the public system or the...
I think there are some advanced trained surgeons out there that are working within the public system or might put you on their public list.
Yeah.
It's getting less and less, but it means you have to go and pay to see them privately. But then they will put you on a private list where they might attend to you themselves, or they might be overseeing a trainee then. So they're there overseeing the work as well. So that would be your best port of call if you don't have the money. And then access your GP to the chronic health management plans that are out there now, because you can get up to 6 visits for pain management.
Well, that's no.
Yeah, and then the mental health plan is really good, because then you can go and see a psychologist, and up to age 25, you can get free psychology through Headspace.
Yes, that's right. And these people focus on pain management. You can get particular ones that focus on pain management as well.
Yeah, you can get pain management. And then if you can't afford it, there's apps like the Curable app, which is quite good. Insight Timer, which helps with anxiety.
Yeah.
Listen to people like podcasts and things like this, get some information, and don't be scared to, save a little bit of money and then go and see a private gynecologist or an expert and get their advice of how they could help you steer you through the public system and ways to make things cheaper.
Yeah, definitely. Because it's not taking away from the public system at all. Like, they do great work, but sometimes you just, it's your body. So you want to make sure that person knows and understands your body, and you're not another number that could potentially get.
That's right. I say to people, if you can afford it, go private every time and see an expert because most of them are private specialists. But if you can't and you have to go through the public system, try and find a private specialist that works within the public system, and it could help you steer you through it.
And even if you have to go on that waiting list, like you were saying, in that meantime, you can try to do your own pain management until you can see them with the apps and the, audio books and podcasts from professionals.
Yeah, and work with a good GP. Try and find a good general practitioner that could help you with pain management and, some of the pain plans, and help you till you can get the surgery.
Yeah, that's good. I never really thought about.
Yeah. So finding a good GP is hard too. I suppose it's like finding a good mechanic, finding anyone.
Yeah, that's true, because they only, and a big thing my friend and I always talk about too is like general practitioners are exactly that. They generally know about little, so don't always take their word as like Bible, like go out. you'll find somebody that, you know, will listen to you.
Yeah, and they're not a specialist. They are a general practitioner and a generalist. And that's unfortunately, you know, that's their scope of practice. But what they should be doing is referring you to a specialist.
Yes. Yeah, that's a big one. People need to know is that you need to be sent on to a specialist for sure.
Yeah, and I think that's probably like you've learned along the way is without seeing those right people, you've had all those things missed along the way. And you need a team when you like you or just a woman with endometriosis on your own, you need a team approach.
Yes. Oh my gosh. I feel like at the moment, probably because I've just had surgery as well, but it's like, other than my work and this house, that's like my third full-time job. It's like, okay, what appointment do I have to do? Because I don't want to ever have to go through, you know, I don't want to have to start from scratch.
Yeah.
I want to use this now as like, let's just keep going forward, no backwards. I've had enough backwards time, and I'm not going back there.
And work within networks. Like when I do recommendations for people, I'll say, well, you need to see this person, this person, this person, and only see those ones because they're the ones you need to see, and just have it sort of mapped out.
Yeah, well, that's great to know, because I'm learning so much more now, is, you know, getting other types of appointments, like seeing a psychologist that focuses on pain management. I've never really thought of that. I've just seen stuff for past things and anxiety and whatnot, and physio, obviously. I've never really done that for that area.
Yeah.
It's amazing. I feel like after these next few months, I'll be like a new woman.
Yeah, so you'll need a pelvic floor physio.
Yep.
You'll need a good GP. You need a psychologist. You need a pelvic floor specialist and like an advanced trained surgeon. You'll probably need someone that can do either complementary medicines or integrative medicine to help you. Or if you can find people that can do multiple things, that's even better, because then you've got sort of a one-stop shop, or you're only seeing a few people in, which makes it a lot easier.
Yeah, I feel like that's kind of unheard of. And many of you out there, I feel like if I start promoting you do all these things, you're going to be like, you'll have more time to yourself.
Well, I'm trying to start a group of experts called the Experts Program, which I'm training up actual healthcare practitioners, medical practitioners, allied healthcare professionals, just on women's health, endometriosis, adenomyosis, PCOS, interstitial cystitis, and the lot, and giving them systems how to help people. So that's my main aim.
Oh, that would be an absolute game changer, because you can just feel so overwhelmed and you just don't know where to start or where to go or who to trust. So if you can find it all in one spot, that would just save so many people's lives, I feel.
Yeah, I think so. And then matching, because you probably go and see people and you're not going to gel with everyone. So we're going to try and match people with the personality.
Yeah, oh, that's a big one too.
Yeah, it is.
You're not going to gel with everybody, and it's such a private thing. Like, I feel as women, especially, we kind of, well, a lot of us kind of pretend things aren't as bad as what they are, and well, you can't open up to certain people if you don't feel safe, and you're, because you feel like they're going to be like, oh, get over it. So it is so important to feel comfortable, otherwise you're not going to list everything that's wrong. Out of fear of feeling like you're a whinger or you're crazy or you've got too much going on. You can be overwhelming. I've got to the point now, I don't care if people think it's too much. I'm like, this is it. I've hit it for too long. If you don't want me, I'll go to somebody else.
No, just get it out there. And it's interesting because you said before, I think, you know, there are a lot of things women can do at home. I always say to them, look, don't try and treat yourself, because you can't. But at the same time, there are things you can do at home. Like you said, you know, a lot of women with endo and adeno and all that, and even interstitial cystitis, will have pain with intercourse. And no women should have to not have pleasure in their life in that aspect. So there's things you can do, like dilators are one of the things. There's wands now that you can use. And, you know, even using like the eggs.
Yes.
And it's like a reverse Kegels exercise in some way, but I tell them it's like if you have a sore muscle, then you massage it. But how do you massage that area? So it's using things like that to dampen down some of those nerve endings. And a lot of women can do that at home in their own privacy.
Which is so much more relaxing, and you probably would feel more likely to do that rather than with a stranger around. So yeah, I never even thought of that I would have to do something like that.
Yeah.
Until after, yeah.
It's like going to the PT. You'll probably see the PT once a week, but then in between you have to go and do all the exercises.
Yeah.
So it's the same thing. You go and see a pelvic floor physio and then do your exercises at home.
Yeah. Yeah. You got your homework for the.
You got your homework.
It's never ending. See, it really is like a third full-time job.
It is. It is. But managing it's really hard. That's why you will need a team, but it becomes you've got to watch the dollars too, and expensive.
It adds up, and that's another stress I found. Growing up, I never would have been able to do all of this now, and I just want to make sure people don't feel overwhelmed and think that they can't either. That's why it's good to give them like baby steps or
baby steps
to lead up to, so it's not like, because it is a lot of money to get the right help, and it's sad because it shouldn't be, because we didn't ask for this to happen to us.
No.
And that causes more anxiety too, the stress of the money or Medicare not covering certain things. And obviously private health is so expensive. I never got private health until last year. Like that's how long it takes for some people, especially when you're a single person. It's a lot of expenses. So I don't want women or people with wombs to feel overwhelmed by that, and know that you could do like baby steps to get all of it and not.
And that's right. And there's things you can save up. Like my daughter is a student, and a poor lowly student, as she said. But for her, she said I would just put away $20 a week until I could afford to go and see someone. And
that's a good idea, because again, growing up, I never would have thought about that, because I was never told about how important it is to put myself first. But that is such good advice, is instead of buying that extra $20 bottle of wine or whatever you're smoking, vaping.
Yes.
You're in pain. I'm sorry, but what do you want more in the long run? Do you need that bottle of wine? No, you can put $20 away to see somebody that's actually going to be a game changer and help you so you don't have to suffer for as long.
Because a lot of stuff women have to do costs money, right? To get your nails done, it costs money. To get your hair done, it costs money. Like you said, buying a bottle of wine costs money, or it might mean not going out and having takeaway and Uber Eats every night for the next week, and just putting a little bit aside and being able to see someone really good.
Yes, that's so true. God, I wish I knew that when I was back at uni.
Oh, so do I.
I could have saved.
We need the Scott Pape, the barefoot investor, to be on here and telling us how to put the money aside.
Oh my God, yes.
What do you think, before we wrap up, what do you think is the best message you could get to women from you, like your personal experience? What would you say to women? Like,
I would say that obviously that what we touched on before was no two bodies experience anything the same, and how important it is to trust your gut. If you're seeing somebody that you feel isn't listening to you, or is passing you on to somebody that is also not listening to you, it's like a hairdresser. You're not going to go to the same hairdresser that gives you a shit cut, are you? You're going to be like, oh, I'm not going to go back there. I'll try somebody else. It's the same. Like you know your body. So trust that there are great people out there. I know sometimes it can feel so debilitating and you can feel so defeated because you're passed around, or you've got anxiety, or you've just got this, or you've just got that. But there are people that will actually hold space for you and listen to you, and you're not alone. And don't suffer in silence. I feel like we've been suffering in silence for so long. You don't have to anymore. Because there's excellent people out there that you can speak to and learn from.
And I say that to people in anything I see, whether they're fertility or women's health. The value of a second opinion, you can't put money on it.
No.
because, you know, you might not want to tell someone your story over and over again, and don't be scared to get 10 opinions, 20 opinions if you have to,
Yeah.
because you'll find someone in the end that will listen to you and hear you out.
Oh, definitely. That's the biggest thing. I think for Endometriosis Awareness Month is just, if you even think for a second there's something wrong, you're probably right because you know yourself, and definitely go get it checked. Because like you said, period pain is not normal.
No, it isn't.
Because a lot of people ask me what the symptoms are, and I'm like, well, everybody's is quite different, but the main ones are obviously, I mean, you can always Google them, but
Yeah, so the main ones are like period pain,
yes,
pain with intercourse,
yes,
that usually bowel and bladder issues, fatigue. You talked about the fatigue,
yeah,
ovulation pain, pain on defecation, pelvic pain. And then there's other symptoms like passage of large clots, profuse bleeding, which you see with adenomyosis, the irritable bowel-like syndrome, and then the UTI-like symptoms that women think they've got a UTI, but it's not really a UTI. It's either interstitial cystitis or it's the endometriosis flaring off as well.
oh, I can't even count how many times somebody put me on antibiotics for and I'm like, I haven't even been having sex. How am I getting all these UTIs? Oh, maybe you're wearing your bathers for too long, or maybe this, or do you wear your active wear for too long? And you always go, oh yeah, maybe. But it's like, no, you know there's something wrong. Don't listen. Go get it checked out. That's the biggest thing. Go get it checked out.
That's right. And I always say that about myself, you know, like get it checked out. And even though you might have a disease, it doesn't make you an expert. So go and see an expert. Like even me, I have to go and see an expert. So,
yeah.
But there are things, it's important to be educated too. So it is important to go online, make yourself educated, but find the right groups and right people.
Yes, definitely. Don't get stuck just, and there's so many people that offer you so much advice, but again,
Bad advice.
Yeah, be careful because it can get very overwhelming.
It can, and make it worse.
Yeah, for sure. That would be the biggest thing. Is just go get yourself checked out. And plus you're worth it. Like nobody deserves to live in pain for something that they did not, it's not your fault.
No.
So go get help because you deserve to be pain-free.
That's right. And if you are diagnosed too, the other part is if you've got a sister, tell your sister to go and get diagnosed too, because it's hereditary. There'll be a family history of it. Talk to your mother and say, Mum, I think you had it. You would have had it. Or, if they end up having a daughter, just be careful to say, hey, look, I've got this. They're probably going to have it. So it's, watching them too. Sisters unite.
Exactly. You got to share the love. What do they say? I love one of these sayings where it's like, knowledge is power, but shared knowledge is even more powerful.
Yes, it is. Knowledge, and that's where it's very important to get education out there, but then also finding the right people to help you. Once you've got the education, what do you do with it? Then go and find the right people.
Yes, definitely. That's what we can share for Endometriosis Awareness Month, I feel.
It is. Angie Kent, thank you so much for sharing your story. It's always a pleasure, and I hope women can learn something from this and from you, because you've got a great story, and you ended up having like the trifecta or the quinella.
God, it's like trifecta plus. It's like the five-fecta.
It is, and the other bit too is while I'm here, they're laughing about it. It is important to laugh too, because it's debilitating, it's serious, but you've also got to have a bit of a laugh too. Otherwise, not good.
Well, it's ongoing. It's not something that it doesn't go away. With the endometriosis, you can manage it, but you got to you can't. You got to be able to get up and still laugh, even though I don't want people to ever feel offended by that, because I know how debilitating it can be. But
correct,
you've got to have fun.
Yeah, you do. And having had a chronic pain thing myself, I know those days where you just don't want to talk to people and it's not fun. but you also know you've got to get up and enjoy life. But it is management. It's constant management. It's a lifelong journey. And it's just, if you manage the disease properly, you can live a fairly normal life.
Exactly. It's all about managing it.
Managing it. That's it. All right, beautiful Angie. Thank you so much for taking your time. I know you're a busy lady, and I'm sure people will get a lot out of this and just learning from your story.
I hope so. Thank you for having me.
That's all right. Thank you so much for being part of it. And thank you for everyone for listening as part of Endometriosis Awareness Month. And yeah, and hopefully remember that period pain is not normal, and go and get diagnosed.
Yes, that's the big one.
Thanks, Angie.
Thank you.